This is a quick video to give you some ideas of how to decrease the cough. Lots of people are having an irritable dry cough that is prolonged after having COVID. And there's a couple of tricks that are worth trying to hopefully get rid of the cough. So the first thing to know about is you have lymph nodes and your lymphatic system that runs down behind your ears, down the side of your neck, and into the supraclavicular lymph nodes that sit here over top of your collarbone. The supraclavicular lymph nodes, they drain your lungs and they drain the sinuses and your head. And if they get a bit overwhelmed, it's like having tea leaves stuck in your sinkhole and you need to use a plunger to get them out. So we want to have really good flow. This is where our antibodies are made, but it's kind of our sewage system. It's got to get rid of all the gunk. So we can do a little bit of self-massage just to help get this moving. And we just use the opposite hand, come across and circular or zigzag motion. And the pressure is downward. What you'll feel there is there's a whole lot of muscles and we're going around these muscles or over these muscles, and underneath those muscles are the supraclavicular lymph nodes. This area should actually be really soft and it often feels quite hard, which could be a combination of tight muscles and lymph nodes being a little bit enlarged. So we do the circles, use the opposite hand so that those muscles don't tense up too much. Do it for a minute or 2 minutes, and it's really normal for it to go red. If it goes tender, that's normal too, but what I'd do is I just would leave it and come back to it in maybe 24 hours. So if you can, you do 1 to 2 minutes up to 3 or 4 times a day. And it's also worthwhile to continue to do the cervical lymph nodes too. So you just come in behind the ears and it's that circular or zigzag motion again and coming down the side of the neck and putting pressure inwards and downwards. So you're actually just trying to cause a bit of friction. You'll feel the skin warm up and it's that wriggling and jiggling that just helps get the circulation going, get the lymphatic fluid moving. Those lymph nodes are like a bunch of grapes. Just right down the side of the neck. And then if you've got time, just another minute down at the bottom in those supraclavicular nodes. So I would do that every day if you can, have a break if it's tender. Sometimes it'll stimulate a cough, in which case you just stop and use the next trick that I'm about to talk about. So the other thing with a cough is we have a cough reflex, and the more we cough, the more sensitive the reflex gets. So we have a trigger, it might be a postnasal drip, and then we have this desire to cough. If we do cough, that cycle gets more and more sensitive. So as you can imagine, it's a bit of a vicious cycle and we need to try and prevent a cough. Every time we prevent the cough, we're one step closer to desensitizing that cough reflex and hopefully getting rid of the cough. Think of it like a mosquito bite, and the more we itch, the itchier it gets. So the trick is sip, swallow, relax. Take a little sip of water, sip as opposed to a glug, swallow hard, and then breathe, nice deep breath in through the nose, down low into the belly and slow, and breathing out, relax those shoulders. And as you're breathing in and out, really focus on not letting yourself cough. That is the goal. Good luck with those tips. Hopefully you can get rid of that cough if it's niggling you and it's your last symptom to get rid of.